Today's big developments with the COVID vaccine is a big step forward in fighting this disease. But there are some real concerns we need to cover here, and we're going to bring in the I-Team's Randy Mack to talk about some of the scams that might be going around, and of course, clinical nurse Alice Benjamin. Nurse Alice, we're going to start with you. If you are looking to get the vaccine at this point, what should you know? Where do you begin?
Well, I think one of the most important things is to understand that an immunization is going to be very important with helping to rid us of this COVID pandemic. I mean, you need to get your vaccine, and as well, while we're waiting for this vaccine to spread to everyone else, it's going to be very important that people make sure that they adhere to the wearing masks, social distancing, limiting activities until we can get a large amount of the population immunized, because it's going to be key, as well as side effects. It's going to be very important that people are aware that side effects will occur and may occur with this vaccine, and to prepare for that, but to not let that deter you, because to have side effects is far less, you'd rather have the side effects than you would to have the actual COVID-19 vaccine, because that is something we are definitely trying to avoid.
Nurse Alice, what do you say to people who may be hesitant to take the vaccine? And we've seen studies that as many as 40% say they want to wait on the sidelines for a while. What would you say to them?
Well, I think the most important part is to educate ourselves on this, that it's very important. And we're backed up in a corner. I mean, we have how many thousands and thousands of people who've died from this. Our ICUs are filling up. We are running out of options. And so right now it's going to be very important that people truly consider getting the vaccine. It's going to be very important. And again, to maintain those washing your hands, wearing a mask, because right now we don't have a choice. I work in the ICU, I work in the ER, I'm taking care of people, and I'm seeing people die from this. And so I think it's a scary thing to be confronted with a vaccine, especially since we seem to feel like it's happened so quickly. But we have to look at the science, look at the data, and inform ourselves. And if any questions arise, please talk to your healthcare provider. They'll be able to guide you, because there will be a small population of people who may need to wait for the next round, such as our pregnant women, women who are breastfeeding, our young children, people who are immunocompromised, who have HIV, AIDS, or cancer. Some of those people may need to wait to get the vaccine, but it's still going to be very important that you seriously consider getting the vaccine.
Randy, I promise you I will get to you in just a second, but one more quick question for Nurse Alice. What about people who've already had COVID? Do they have immunity? Should they line up for the shot as well?
So what we know is that, so you're talking about natural immunity. When you get COVID, get an infection, hopefully you develop some type of immunity afterwards. We don't have enough information to say that after you get COVID-19 that you have lifelong immunity. We have seen some cases of reinfection. When you look at the Pfizer research, there just isn't enough data to say that if you've had COVID-19, you don't need immunization. And it's actually suspected that they will need a COVID vaccine somewhere later down the line, and almost considered as a booster shot, which would provide some continued immunity. So if you've had COVID-19, you're not excluded from the vaccine quite yet. It's possible you still will need it in the future.
All right, Nurse Alice, we're going to ask you to stand by for a moment. Randy Mack, there's something else we have to worry about with the vaccine. We're talking about scams here. I-Team consumer investigator Randy Mack is here now. Randy, the FBI already looking into some of these scams?
That's right. They say the scammers are already hard at it, sending out phishing emails and text messages promising information about the vaccine. And if you click on them, those will download malware into your phone or into your computer or whatever device you're using. That could compromise any account information that you actually have in that device. They also may call you and ask you for your social security number or other personal information, again, in lieu of giving you information about the vaccine. Everyone should know that that is not how information about vaccines are going to be disseminated. And so if you receive one of these calls, or if you get one of these messages, certainly don't click on them. And if you receive one of these calls, go ahead and hang up, because again, that is not how the government or any local authorities are going to be disseminating information about the COVID vaccine.
All right, Randy Mack, thank you. Nurse Alice, thank you. And a reminder, if you see something that offers a magic pill on the internet, that's not how this works. It is definitely a shot. Thank you both.
Yes. Thank you.